Just want to give a brief overview of what we think should be included in a very simple and basic first aid kit. And I want everybody to keep in mind, this is not an all-inclusive kit. What we want you to do is have the basic items needed to stop blood flow, administer some pain relief, maybe sedate a horse, be able to bandage a leg with or without some type of medication or ointments on it. This is not supposed to be a kit that includes every type of treatment that we could do at a clinic. There are a lot of people out there that have the ability to use a lot more intensive kit than what we're going to put together here, but I think this is a kit that you can keep fresh and up to date at all times without wasting a lot of medication that goes out of date. What I think probably forms the basis of a good first aid kit is, number one, going to be a few syringes and needles that you can administer your injectables with. I think a good, most of your injectables are going to be that you should be using in an emergency situation are going to be anywhere from 1 to 3 cc's of some form of sedative, such as xylazine, anisette here, up to 10 cc's of Banamine. You might have some dexamethasone, but I really don't recommend that the average client have that on board. And enough needles to where you can continuously use a fresh needle if you have to administer multiple injections. So a few 3 cc syringes, a 6, a 12, a 20, maybe a 35 would get you the ability to lavage with saline, clean your eyes out, things like that. We move on. I think one of the most important things is to have some form of hemostasis. This new Celox Veterinary is an impregnated gauze, and it comes in either a roll or a gauze pad. And what that is for, if you have arterial bleeding or heavy venous bleeding, you can actually clean your wound and pack this directly onto the bleeding wound and then bandage over that with either gauze for a pressure wrap or gauze, and you can see our cotton padding, vet wrap, and elasticon here, and that would at least allow you to get to veterinary care without worrying about your horse bleeding out. Some other things that you might consider: one of the most easiest to use sedatives on the market today is this Dormocidin gel. This is applied under the tongue. It's not made for you to try to get your horse to swallow. Apply it under the tongue and let that be absorbed. Unfortunately, it takes about 30 to 40 minutes for maximum effect, but it can be used in an emergency situation, or it can be used just to simply help you calm a fractious horse and bandage a leg. If you need something quicker, you're probably going to be better off using your anisette or xylazine. It can go intravenous or intramuscularly for a response time in the 3 to 10 minute range. A couple of other things that we've got here: some Banamine paste, which could be used mainly in cases of colic where you could not get to immediate help, and some phenylbutazone paste. That would be more for musculoskeletal inflammation. If you've got a colic, I really prefer that if you're going to seek veterinary help within the hour, you refrain from giving any forms of painkiller, any Banamine, preferably even keep from giving any sedatives. Those can mask the signs that we look at when we're trying to assess the severity of colic. A couple of other things to have: number one, a good pair of bandage scissors, and we'd like you to be able to apply some type of ointment to a wound to both keep it moist and to inhibit bacterial growth. Just a plain triple antibiotic ointment, you can get that anywhere, any pharmacy, is a good idea to put on fresh wounds. And barring that, you could also use a good gauze pad and moisten that with saline or water and just put it directly over a wound. That keeps the external debris out and keeps the wound moist. Another thing I like for everybody to have is something on the order of a triple antibiotic ophthalmic ointment. This would be handy in the case of an eyelid laceration, where you could just take some saline in one of your syringes, squirt into that wound, get the eye lavaged out, and then put you a small amount of this on the lid. You can watch one of our instructional videos on how to apply that, and that would at least get you prepared for the veterinary visit. Would rather you didn't have a broad range of ophthalmics on hand, because there's a lot of instances where you can choose the wrong one and cause more damage. that pretty well basically completes a first aid kit that I think every owner should have on the trailer. There's a lot more out there that you can use, and I think you should strive to be knowledgeable about, but this is what I carry for the most part. Anything beyond this, I need to have more advanced help, I think, on the way. So if you have any questions about how to put one of these together, most of these items can be purchased over the counter, and the rest you can get from your veterinarian. Thank you.